Welcome to episode 1 of the whiteboard animation videos by Dermadreams. Today's topic is melanoma, and we'll be addressing the question, what really is melanoma? Melanoma is a serious type of skin cancer that develops when melanocytes, or cells that produces melanin, starts to grow at an uncontrollable rate. Here we have a drawing of an integumentary system with the major skin layers labeled, including the epidermis, dermis, and the fatty layers in the hypodermis. Located in the lower epidermis, this is where melanocytes start becoming cancerous when they start mutating, and then they start spreading down deeper into the skin. As melanocytes mutate, you can see on the surface that it looks like a mole is growing with it as well. Although melanoma makes up only less than 1% of all skin cancer cases, it actually makes up the majority of skin cancer deaths. This makes it one of the most dangerous type of skin cancers. Melanoma is actually much more likely to be metastatic, which means that it can grow and spread at much greater rates than other skin cancers. In the end, this makes it a lot more difficult to treat. Let's talk about how exactly does melanoma develop. It all begins with melanocytes. Melanocytes are the cells in your body that produces melanin, a pigment that gives your skin its color. In this diagram, you can see the melanocytes in normal skin. There is an adequate amount of melanocytes that regularly die off and regenerates. Or in other words, these cells go through cell apoptosis. Sometimes a cluster of melanocytes can form a nevus, also commonly known as a mole. The development of nevus cells are generally formed by exposure to sun damage, and they are most commonly present in those with fairer skin. They are mostly a benign growth on the skin and are a variant of melanocytes. However, when the DNA and skin cells are damaged, melanocytes might fail to go through apoptosis and continue to grow without dying off. This leads to rapid mole growth. If it's caught early, it's highly treatable. But unfortunately, many studies find that patients are often diagnosed too late. Once cancer has reached the lymphatic system and/or the blood vessels, it can spread to internal organs like the lungs, liver, brain, bone, or gastrointestinal tract. Cancer survival, it's important to know what to look for when encountering an abnormal mole. Thinking of the ABCDE rule can help you remember what to look for. The first sign is asymmetry. This is when one half of the mole looks different than the other half. B is for border. Some abnormal moles have blurred or jagged borders that are signs of skin cancer. C is for color. Shades of black, brown, or tan may be present. Areas of white, gray, red, pink, or blue may also be seen. Generally, it's a dangerous sign if a mole has more than one color. D is for diameter. There is a change in size in abnormal moles, usually an increase. Melanomas can be tiny, but moles are larger than the size of a pea, approximately larger than 6 millimeters or about 1/4 of an inch. Generally, if your mole has a diameter of more than 5 millimeters, it's time to see a doctor. E is for evolving. A sign of an abnormal mole might be the fact that it has changed over the past few weeks or months. This might be a change in size, a change in color, or a different.
As we age, our years of sun exposure increase, and therefore the risk of melanoma increases. There are different stages of melanoma. These include localized, regional, and distant melanoma. With each progressive stage of melanoma, the 5-year relative survival rate decreases. For localized melanoma, there's a 99% 5-year survival rate. Regional melanoma has a 66% 5-year survival rate. And distant melanoma, the most severe form, has a 27% 5-year survival rate. Total, all of these stages, known as SEER, S-E-E-R, stages, have a 93% 5-year survival rate. important to diagnose melanoma early on so that it can be treated before getting to a more serious stage. Prevention is key. Make sure to avoid UV light, especially between 10 a.m. to 4 p.m. Also, be sure to use sunscreen, ideally greater than SPF 30. Make sure to wear protective clothing and sunglasses. And lastly, be sure to examine your skin regularly. And that's a wrap on episode 1 of Whiteboard Animation Videos. Thank you for watching, and be on the lookout for more.